the first patient at each site, and targeted 60% SDV for other patients, focusing on critical variables to quality. Frequent but targeted on-site monitoring visits would be necessary for this early phase of development of this novel product. And there will also be centralized data review of site risk indicators and data trends. And the centralized review, you'll note, is a common component across these three examples. Second example is a type 2B, a phase 2B type 2 diabetes mellitus study with an investigational product that is one of a member of a well-known class, among which there are a number of approved agents. We would take an approach of 100% SDV of the first patient at each site, targeted 20% SDV for other patients, focusing on critical variables, a data-driven monitoring visit schedule with for-cause visits otherwise, and again, the centralized data review. And then finally, an observational study of a marketed product, not a controlled trial, not a safety and efficacy study, 100% SDV for a limited sample of patients, centralized data review for site risk indicators, and additional for-cause visits triggered by data review. So there's the scope, the scale, or the progression on the degrees of intensity on a risk-based approach. So I just wanted to call your attention to the history of this phenomenon of risk-based monitoring. And there's a timeline here that goes back to 1988 and the original FDA guidance on monitoring of clinical investigations. You'll note that it was retired in 2010, specifically as FDA was developing their draft guidance on risk-based monitoring that is now final. So the take-home messages here, without going into the historic detail, is again that there has been a long history.